How's it going?
Oh, very nice. I'm a nursing student with SPC. Could I possibly get an SBAR on your patient?
Oh, sure, yeah, we're about to go in and administer some insulin. I have a patient here. He's in room 407. His name's Greg White. He's 67 years old. He's an African American male. He's got no known allergies. He's a full code. Let's see, he was admitted with a stage 2 diabetic ulcer on his right heel, secondary to his type 1 diabetes that he's had for most of his life. Um, I've got him awake and alert, oriented times 3. His speech is clear. All his cranial nerves are intact. Let's see. I do have him as a medium fall risk, so you want to keep an eye on him in the room. His gait is steady, but he still is a medium fall risk. His breath sounds were clear. It's auscultation on posterior and anterior on his lungs. His respirations were at 18. His breathing is unlabored. I was checking over his scan and everything. He's got no edema. He does have S1 and S2 heart sounds with no murmur, and his abdominal area, he's got bowel sounds present in all 4 quadrants. He's got no SIDs. It was symmetrical with no tenderness or pain or anything. He's not reporting any constipation or diarrhea or anything. He is on an 1,800 calorie diet that he's not adhering to. And on his intake and output, he's got 320 mLs of output so far that we recorded. I do got some vital signs on him. He did around 1,600, have a 98.4 temperature. Pulse was 80. His blood pressure was 140 over 72. And his O2 saturation was about 95% on room air. I think he did have a reported pain level and those vital signs of a 1 out of 10, so it's pretty low. He has some lab values that we're concerned about. His calcium was at 7.4, that's low, we're going to keep an eye on that. His sodium was high at 141, so he is on sodium restriction, so we're going to be watching that. His blood values and everything were pretty normal. His albumin at 4.2, he's got good nutritional status, he's got good RBC count. So we're really going to be watching out for the electrolytes, the calcium, and his sodium right now. He did have a blood sugar reading of 310. That's why we're going in. We're going to give him some fast-acting insulin to get that taken care of. He's got a couple of different insulins that he's taking, but we need some fast-acting right now. He does have some pending labs. We want to keep our eye out for some labs to come in throughout today. He does have a previous CBC and CMP, but we're looking for a subsequent one that's pending. He also has a wound care consult coming. We got a urinalysis pending, and also some liver enzyme tests and AST pending. So we got some labs and some wound consult pending. So we're gonna keep an eye out for that. He does have an IV also in his right forearm. He's got a 20 gauge with saline lock in his right forearm. Let's see. I think I covered everything. Yeah, his muscle strength was at 5 out of 10 on his muscle strength. But other than that, I'm ready to go. You have any more questions or anything?
Yeah, why specifically is the client receiving this medication?
Again, this is Lispro. Of the anti-diabetic medications and all the insulin, this is the rapid acting. It has a 5 to 15 minute onset with a peak in about an hour and a half, and its duration's a few hours. So we need something his blood sugar is so high right now, we need to get it down quickly, and that's what this is about. It's rapid acting.
So what action does the medication have on the body?
This particular insulin is going to stimulate the uptake of blood glucose into the skeletal muscle. It's going to inhibit the new production of glucose by the liver, or gluconeogenesis. We're not going to have that. It's going to stop production of glucose, and it's going to increase the uptake of it in skeletal muscle and bone throughout the body to kind of reduce that blood sugar.
Okay, when should you question administering this medication?
Well, if I had an AccuCheck that was in a normal range, I wouldn't give it to him. If he was exhibiting any of the signs of hypoglycemia when I came in, I would be questioning it. So I'm going to look at his AccuCheck, and I'm going to look at his heart rate and some breathing patterns and stuff to see if he's exhibiting hypoglycemia.
And does the medication have a therapeutic serum level?
No, we don't monitor the serum level for insulin levels, but we do look at the blood glucose levels after the administration. And let's see, just look at the blood glucose after, but no serum levels for the actual drug itself.
And what vital signs do you need to monitor?
We're going to be monitoring their heart rate, their blood pressure. We're going to be assessing them for pain. And then we're also going to monitor their blood glucose. Usually when they're under this type of therapy, they're going to get it about every 6 hours. You're going to get blood immediately after the administration, but then usually about every.
Excuse me, which physiological parameters should be monitored when a medication is being administered?
We're going to look at their heart rate. We're going to look at, I want to watch their skin for any type of reaction as far as itching and scratching their skin. And again, the respiration rate. Some of the signs would be tachycardia and palpitations of the heart. So I'm going to keep an eye out for that.
And what interventions might be taught to the client to ensure the medication is administered safely in a hospital setting?
In a hospital setting, I'm going to make sure that I have the right drug, the right patient, the right route. I'm going to make sure that we're rotating the site when it comes to diabetic administration. We don't want to use the same site over and over. You'll get that lipodystrophy or maybe some fatty lumps in the area. So.
Okay. What interventions must be taught for taking this medication safely at home?
At home, we're going to teach the patient to make sure that they have the drug is stored properly, that they're using the right drug at the interval when they're administering it, that they're able to check and monitor their own blood glucose at home. I want to make sure that they know how to use the right equipment, make sure they have the right needles, make sure they're throwing them away appropriately, not reusing them, making sure they're sanitizing the skin properly, rotating their sites, and also making sure the drug is not expired and making sure it's not contaminated or anything when you're at home.
And are there any side effects or potential adverse reactions?
Yeah, we're going to be looking for hypoglycemia, and we're going to be looking for anaphylaxis or hypersensitivity reactions. We're going to be making sure their blood sugar doesn't go below normal range. We don't administer too much insulin or administering insulin when they don't need it. And also the anaphylaxis, which is an acute respiratory distress where they might stop breathing.
Okay, well, how do you know the medication's working?
When we get an AccuCheck afterwards, make sure the blood glucose is in a normal range, or we get some alteration in that blood glucose from the 290 down to some number, we'll see that has been effective if we get a reduction in it.
Wow, terrific. Thank you.
Ready to go in?
I am.
Awesome. That's all I need. Hello, hello. Hey, my name's Michael. I'm coming to your nurse today, taking care of you. I've got a level 1 nursing student shadowing me, Don, here. Hope you don't mind. We'll have a couple of us in here taking care of you.
Hello.
What's your name?
Glenn Light.
And what's your date of birth?
It's January 10, 1949.
Okay, I'll make sure we have the right patient. Okay. We're going to be, we have an order to give some rapid-acting insulin. Your blood sugar is very high right now. Looks like it was around 290. You taking insulin at home?
Yes.
Okay, so you're familiar with this medication. Do you have any allergies that I need to know about? Okay. I know you have a pressure ulcer or a sore on your foot. How's that doing right now?
It's a little bit better.
A little better?
It's been clean, so.
What's your pain level right now? How are you feeling with your pain level? I know it was, I think I saw on the computer, 1 out of 10. How are you feeling now?
I don't have no pain right now.
Okay, so your pain's going down. Good. Get some sanitizer drops and some gloves on. I do again have some Lispro, some rapid acting insulin. Where do you usually give your insulin shot? Where do you usually take it?
Last time I took it on my right lower abdomen.
Right lower abdomen. Are you rotating outside at home when you give your
Yes, I do.
injections? Okay. Well, if you've been giving it in the right, I'll probably switch to the left, probably. Is that okay? These might be the most durable gloves I've ever seen. How you doing, Don? Everything okay?
Great.
Let me check this dosage calculation here. looks like we're gonna be giving you 6 units today, based on your blood sugar calculation. It looks like we're gonna be giving you 6 units.
Okay.
That's pro. Make sure I have the right drug concentration. That's pro. 4 times daily, subcutaneous. Today. Swim light. Let's scan your bracelet, all right? That's a green light. That means go. We've given 6 units. We're going to drop 6 units of air in this range. All right. 6 units. We're going to give this in your left abdomen, make sure I've got the right drug, right strength, this part is 6 units, we've got the light. Put in the sight, inside out. And the sharps with it. That's all that's up there. How are you feeling?
Better. Just gonna do a little documentation real quick, make sure I let the system know that I gave your medication. So. Apologize for the delay. You're fine.
Have you, I noticed that you've been managing your blood sugar for quite some time because you had an HbA1c that seemed like it was in a range that you were managing it properly. Has anything happened recently that you, in your lifestyle changes or your diet, that maybe precipitated this spike in your blood sugar and caused this incident? Can you think of anything?
I believe I've been taking a lot of saturated fat.
Well,
So,
fatty foods.
Yeah.
I've got some materials I'd like to go over with you,
Okay.
and
That'll be helpful. Yeah, because I need to get on back to my diabetic diet again.
please. All right. It looks like if you look right here, it talks about the 1,800 calorie American Diabetic Association diet, foods you want to avoid, foods that they encourage you to eat. I'll leave it with you and let you read on it. I'm sure you don't want me to go with you word for word, but we definitely want to make sure that you understand the diet that you're supposed to be on and how to monitor your blood sugar and how to regulate it with the medication that you have. It seems like you've been doing it successfully for a long time, but you've had a
Yeah,
little
I had.
bump in the road here.
Somehow I left.
Thank you. Also, we're always looking out for signs or adverse reactions to these medications. You're going to be looking out for your heart racing, some palpitations, maybe you might get a little dizzy, maybe. But do you have anything that you do at home that helps you deal with these situations if they come up? If you do find yourself in a situation where you have very low blood sugar, do you keep sources of sugar on you?
Yeah,
Some snacks and stuff?
Yeah,
Okay.
I carry all around.
Do you know if you have any adverse effects to report to your healthcare
Yeah.
provider?
Definitely.
Also, at home, we want to make sure that we talk about when you're at home, when you're taking this drug, that you're using the right technique. When we talk about rotating the sites. Also, the right equipment, making sure you're using the right size needle and that you're not reusing them and that
Yeah,
you have a Sharps container at home that you take periodically.
Yes, we do.
Okay.
Yeah.
Also, the insulin that you're keeping in the refrigerator, make sure that you look at the instructions on that. Make sure you know how long can I keep this insulin stored in my refrigerator for this particular brand and type.
As well for the expiration
Yeah,
date.
look at the expiration date, and also make sure you're looking in the bottle that you have the right insulin that you're giving yourself at the time, and make sure that there's no contaminants or anything that looks foreign inside the bottle. And so pay attention to those types of things. And so make sure you're using the right technique, make sure you're using the right equipment, and you're giving yourself the right drug at the right time, which will be based on your blood sugar by accurately checking it. Okay. So definitely want to make sure you have these reading materials and keep those in hand. I'll be back in a little while, and if you have any questions, please feel free to ask me.
Yeah,
I'm not
I'll
going to quiz.
ask
I'm not
you.
going to quiz you on it, but if you have any questions, I know that a lot of times you walk out the door and then you think of the questions, but just keep them in mind, and I'll be happy to answer them for you when I come back. Do you feel good otherwise? You feel okay?
Yes, I'm feeling
Okay.
great.
Let's see, make sure I covered all my bases, make sure I give you all the information. Also, I wanted to make sure I did mention one thing, over-the-counter medications when you're at home. If you're going to take any herbal supplements or over-the-counter medications, make sure that you let your healthcare provider know, because you may not realize there may be some interactions with the drugs that you're taking, all right?
Okay.
All right. So, and we'll see you next time.
Thank you.
Finish up my documentation here. So, Don, did you learn anything?
Yeah, that was great. But let me ask you, were there any pertinent pieces of information you reviewed before administering the medication?
Definitely. I want to check the blood sugar. We're in here giving her insulin for blood sugar, and we're going to check that. And we're also going to make sure that we follow the 5 rights. That we have the right medication, the right patient, the right time, the right route, and the right dosage. We also want to let patients know they have the right to refuse medications. We also let them know they have the right to refuse. They don't have to take the medication. It may be in their interest and prescribed by the doctor, but again, they have the right to refuse. And we also want to make sure we give them some, use the right teaching and information with the patient. Make sure we give them, like we did, the diet recommendations, or how to check your blood sugar, how to safely administer the drug so that they're educated and they can do it effectively and manage their health.
Did this information affect your decision to administer the medication?
It did. The blood sugar check gave me a reading that allowed me to follow the doctor's instructions and use a sliding scale to administer insulin. Had the blood sugar been in normal range, we would have just said not administered, and then we would check back with them later.
And did this information affect how you administered the medication?
It actually, it did. When I talked to the patient when I went in to make sure we had the right patient, right route, right dose, she told me she'd been giving her shot in the same spot in the right abdomen, so we moved over to the left and gave her a little teaching on making sure she can rotate that and avoid that lipodystrophy.
Well, that's great, man. And I just want to thank you for the time that you've taken
No problem at all.
to help me out.
My pleasure.